to the Healthcare Igniter series. Today's Healthcare Igniter is Mark Shaker. Mark has a deep expertise in healthcare. He's been in a strategic role, operating roles, and he's been CEOs of hospitals. So we're fortunate to have you here, Mark.
Thank you, Ron.
So Mark, let's get the conversation going. For as long as I know in healthcare, we talk about healthcare transformation. But from a CEO's perspective, to me it feels like providing the best care with the various service lines at affordable cost, and probably do it profitably so you can reinvest in a program, to improve the population health, isn't it?
It absolutely is. And I think CEOs today, as we look at the transformation in the health ecosystem, are concerned with a variety of items. Financial sustainability is at the top of the list. There's no question about it, because we need whatever profit, 1-2% margins that organizations can generate to be put back into those organizations to continue to build strong and healthy programs. So that continues to be at the top of the list. We're also looking at ways to better understand the social determinants of health. With the new financial models that have come out through the government over the years, there's been more incentive for healthcare organizations to really understand their particular markets and their communities that they're serving. So in order to do that, we need good data and we need good expertise to better improve the health and wellness of our communities. I'd say the third thing that CEOs continue to be interested in are what I would call the technology disruptors, and those competitors that are non-traditional, that we've never had to deal with. Technology disruptors can come in all different forms and fashions, and they can be IT related, they could be med tech or pharma related, but there's an awful lot of activity in those particular markets. And we see it as an opportunity. We should see it as an opportunity to improve care and safety and reduce costs in our organizations.
Very interesting. So technology and data analytics seems to be playing a pretty big role. If you think about health systems, they're already into the operating mode, right? So they add these two elements, but there has to be more elements of business model or structure that they can really take onto it to still serve the purpose of serving the community best in a most affordable way.
Yeah, and that's one of the reasons why we see a lot of standalone hospitals now are joining larger organizations and coming together and merge, large mega mergers really, and there have been several, right, recently, Bon Secours and Mercy and as being one of the big ones. And many pundits say in 10 years there'll be 7 or 8 large mega health system consolidators, and you're either going to be part of them or might not be able to survive. And I would say their main focus is trying to get better economies of scale, better contracting with private insurers, and improving the safe and quality care in those particular markets that they're part of. Back office is always a big part of what they do in terms of consolidation, but it's not just that. It's also clinical consolidation and improvement.
Interesting. Mark, do you see, when you hear today, you kind of get a mixed feeling in terms of what people have been able to extract as a value, the mergers that are happening. Do you see that people being able to get synergies and really, getting what they thought they would get out of it in M&A practices?
That's a really good question, because I think early on in an early marriage, so to speak, of these mergers, many organizations, especially many not-for-profits, take it slow. And they'll take bits and pieces of consolidation and implement them. It's been my experience that the clinical consolidations and improvements come a little later because they're harder to do. The back office functions are a little easier to do, and that when you're looking at legal services, marketing, communications, human resources, and such. But when you get involved in looking at consolidating clinical service or looking at protocol development and trying to get best practice, that's a little bit more challenging because you're dealing with medical staff who have provided care in a certain way, been used to doing it that way, and then when you try to say, well, perhaps there's a best practice within your own group, it challenges your change management capability, to be sure.
Industrialization is kind of what you're saying is happening or could actually happen in this area. If you're trying to drive that change management, what 2 or 3 or 4 strategies that you actually would say people can start working on so they can get to the value that they actually hope to get from the clinical standardization as you will?
Yeah. There's been an awful lot written on change management through the last several decades, and there are several different models that healthcare leaders have undertaken. Really trying to demonstrate what the new world looks like and how individuals taking a part of that can be impactful at the end of the day with their communities is an area that I've thought to be most successful. What's in it for them? If you really can, a lot of this is around leadership and the folks that we have in play to make the change and have change leaders and change managers working with them day in and day out with the tools to help with that cultural shift and cultural change. There's a lot of science behind it, and it's hard work. It really is hard work, and it can take, in some cases, several years to really move the dime. Unfortunately, in many organizations, you don't have several years. So when change happens, and especially if you're in a crisis, it moves along very rapidly, and not always do we have the change management methodology behind it to sustain it. So you might get your objective completed, but the long-term sustainability could be in question. It's very challenging.
It is. It does seem like it. I mean, from the industrial world that I've spent some time in, I realized as soon as you drive a change, you always kind of dig down, and then you have a value. And how you really manage people and organization when people are transitioning, right? They haven't really perfected the art of doing things efficiently.
Right.
To stay and say, look, tomorrow is much better.
Right.
So.
And there's a certain percentage of employees that won't make that transition.
They
just can't for whatever reason, and we try to talk to them about that and find them the right spot in the organization or outside the organization.
That's fair, unless you drive a culture that is aligned to where you all want to go. You have to have everybody on board. It seems like.
Absolutely do. Certainly do.
It's very interesting. You cover the key elements of what people can take on. Starting with the analytics and the value of analytics from a local market perspective, to using technology as a way to differentiate, and from an operating model perspective, mergers and acquisitions and how value is gained. But the challenging and largest opportunity from a care perspective, since clinical transformation through the standardization as much as you can drive. If you play these strategies out, do you have a sense of how much value can be extracted for a health system, and is that really material?
It's very material, and the work that I had done in my past roles in service line development in particular, bringing the physicians together from folks who have been competing with one another for years and years, by getting them in a room, trying to develop an overall business plan and a proposal to move that service line forward and make it the very best and safest and highest quality that they possibly can do, and be very open and honest about everybody's performance. Yep. And talk about why it is that Surgeon A has better outcomes and shorter lengths of stay than Surgeon B, and how they can learn from one another. But as I said earlier, that's very difficult. People have to get very comfortable with one another first in sharing that data and being open and honest about what works. Sometimes it means changing the tools of the trade that they might be using. Orthopedic surgery is a good example. They may use a particular device and equipment around that device that they've used for 20 years. And to say, well, I think if we switch technologies and techniques, that we may be able to actually have a better outcome for this particular patient population. And I've seen it work. Again, it doesn't work overnight. It's a work in progress, but the clinical transformation of our organizations will be key in order to get that financial sustainability into the future. There's no question.
It's incredible. You can improve quality of care, and you can reduce the cost of care. by multiple of this the strategies. And maybe there are more details to be had in each one of those areas that we can probably touch upon over the period of time.
Yeah.
But this has been fantastic. Thank you, Mark,
Thank you.
for sharing this. We look forward to having more thoughts from you over the period of time. But this is very enlightening.
Thanks, Pranav.